I guess my first question would be, how have we used information that we're getting from other countries or other cities for that matter to kind of make an assessment of what we can expect here?
Well, we can look at the others' experiences to try to predict when we're going to have the peak or not, and then that can help inform us in terms of when we expect more hospitalizations. So some of the best models suggest that we already hit the peak in terms of daily infections in California. That should continue to decrease. This current surge should continue to get better. However, hospitalizations and ICU admissions, those tend to follow by a week or two after the peak. And so what we're expecting is that hospital resource use is expected to peak in California sometimes toward the end of this month. We also know specifically, for example, with children, that MIS-C, the multisystem inflammatory syndrome in children, generally follows acute infection by 2 to 4 weeks. So if we saw the peak this week with acute infections, we expect more hospital admissions for MIS-C over the next 2 to 4 weeks.
I'm actually a little bit surprised to hear that you think that we have already peaked here.
Yeah, that's in terms of daily number of infections. But then after people are infected, of course, they start off with relatively mild symptoms, and then that does progress and until they do get more severe symptoms and complications occur that they do require hospital admission. So in California, the models suggest that we've peaked. In the US as a whole, also, it suggests that this current surge has peaked. Some states are about a week or two later than the US as a whole, so it just depends where you are.
But like you said, the real worrying things are hospitalizations, right, and deaths. And you said, I think you said 2 to 3 weeks. But you can, what you
Yeah, so
said.
the hospitalizations and deaths tend to occur about 2 to 3 weeks following the peak in terms of the number of daily infections.
How are we doing here in the Sacramento area?
Well, hospitalization rates are increasing, and so all the hospitals in the area, they do have plans, contingency plans to take care of patients. And in addition to more patients being admitted because they're infected, of course, healthcare workers are a part of the community also, and so more healthcare workers are being impacted also. So that's being monitored very closely in order to make sure that everybody gets safe patient care.
Did we drop the ball on Omicron?
I think that we, of course, always are going to expect variants to occur, and we need to anticipate that. Having the high vaccination rate will help in terms of mitigate any kind of severity of infection. And so the vast majority of hospital admissions, for example, are among unvaccinated individuals. So the best thing we can do to be prepared is to have a high vaccination rate locally, and then to prevent these variants from developing, having a high vaccination rate worldwide will help prevent that. And we've done a very poor job with vaccine distribution to several areas of the world. So we do expect that for those areas with very low vaccination rates, high rates of transmission, that really facilitates viral replication and then the opportunity for new and more dangerous variants to develop.
Do you think this experience will help change the way that we look at that, vaccinating the world?
Oh, I would hope that it would change that, but realistically, I think everybody's out to take care of themselves. So most countries want to make sure that their citizens themselves are protected, and that's natural. But what that means is that countries with more resources are now giving third, even fourth doses of vaccine, whereas other countries, even healthcare workers, a minority of healthcare workers have been vaccinated because they just don't have enough vaccine. So it's not an equitable distribution of vaccines currently.
People who are just starting to think about taking precautions when it comes to Omicron, has the bus already left?
I think it's never too late to take measures to prevent infection. So I would encourage people to be vaccinated, to continue to mask when you're around other people outside your household. If you're vulnerable to more severe infection, avoiding large crowds is appropriate.
And after this, are we done with variants?
Oh, no, we're not going to be done for variants. I don't think we'll ever be done for variants. It's similar to influenza. I think there'll always be strains circulating. There's always going to be change in the strains that are circulating. But what we can hope for is that the variants will develop less frequently, and that as we build up at least partial immunity, that when we get these surges, that they result in mild infection because people have partial immunity, either from vaccination, hopefully, or previous infection, that then these breakthrough infections will be mild. They'll be generally outpatient illnesses, and they won't result in a high rate of hospitalization.
And what do you hope that this experience teaches us? Maybe like how can it inform us to plan better for next time or the next surge that should happen?
Well, public health has historically been underfunded. Whenever we have an outbreak, a new disease, whether it's Ebola or Zika or H1N1 or COVID, people pay more attention to public health. But I would hope that really funding for public health can be more sustained, because we really need a robust public health infrastructure to address these issues. And we will continue to be challenged with new pandemics.
Okay, I think that's all my questions. Been very well informed. Anything you want to say I haven't asked you about?
I can't think of anything else. Thanks.
Okay, sure to appreciate your time.
Great. Thank
All right.
you. Bye.